Good afternoon. It gives me great pleasure to introduce our MC for today's session, Dr. Toya Barnes-Teamer.
Thank you, Pam. Welcome to United Way of Southeast Louisiana Public Policy Educational Session 2. This session will focus on financial stability and community strengthening. As Pam mentioned, I'm Dr. Toya Barnes-Teamer, and I have the honor of serving as chair of United Way of Southeast Louisiana's Public Policy Committee. In my private life, I am the owner of Teamer Strategy Group, LLC. I will be your host for today's program, and as we get started, I'd like to clarify a few housekeeping rules. This session will be recorded and shared with all registrants. There will be time for questions and discussion at the end of the program, and we would like for you to please share your questions using the chat. I would like to thank all participants for joining with us today. You may ask why we're hosting these sessions. Every year, the United Way of Southeast Louisiana creates an agenda outlining our priority public policy issues in health, education, financial stability, and community strengthening in preparation for the start of each legislative session. United Way's legislative agenda advances our fight to eradicate poverty in Southeast Louisiana through our Blueprint for Prosperity by supporting ALICE, asset limited, income constrained, employed individuals. We focus strongly on public policy because it is one of the most effective ways to drive the system level change our community so desperately deserves. These educational sessions allow our Public Policy Committee to gain insight from experts on key public policy issues and develop a comprehensive legislative agenda. We also collected information on the legislative priorities of the United Way's community impact partners, who provide critical on-the-ground services to vulnerable populations across Southeast Louisiana. It is now my great honor to welcome today's esteemed panelists. Larry Frieman with the Louisiana Department of Justice, Ali Roussel with the Louisiana Department of Children and Family Services, Stacey Roussel with Invest in Louisiana, and Mariah Wineski with the Louisiana Coalition Against Domestic Violence. I'm now pleased to introduce to you Michael Williamson, President and CEO of the United Way of Southeast Louisiana. Michael will frame today's presentation by providing you an overview of the ALICE households in Southeast Louisiana. Please join me in welcoming Michael Williamson.
Thank you, and good afternoon, everyone. Thank you, Toya, for your warm introduction, and thank all of you for joining us. So let me more formally introduce you to ALICE. Let's start with ALICE is an acronym for Asset Limited, Income Constrained, Employed. And these are folks that day in and day out struggle financially, often unable to make ends meet. They may be a relative or a friend, or as I often say, one of us may have been ALICE, like we were in my family in the early days, if you will. So, and even someone on this call today or Zoom may be ALICE as well. ALICE is cashiers, waiters, childcare providers, and other members of our essential workforce. And they earn just above the federal poverty level, but just less than what it takes to what it costs to make ends meet. And we all know that when ALICE households can't afford the basics, they are forced to make really difficult choices and trade-offs every day, impossible decisions like whether to pay for prescriptions or keep enough food on the table. The larger gap between income and expenses, the more extreme the decisions are, and the greater the risk to the family's immediate health, safety, and financial stability. We all know financial hardship not only affects individuals and families, but it also has a negative impact economically and socially on the wider community. ALICE also represents the data reshaping the dialogue on financial hardship and a grassroots movement that is picking up steam across half the U.S. states and counting. I'm proud to say that now approximately 36 states across the United States of America are actually ALICE report states and using the data to inform their decisions. Unfortunately, Louisiana had the second highest ALICE rate in the nation, with 51% of households living below the ALICE threshold, behind only Mississippi. Now let's dive a little more to Alice in the state of Louisiana. And what we've seen over time are three trends are increasing. First, increasing cost. A family of four with two children in childcare's budgets increased from $66,288 in 2021 to $78,744 in 2022. We've also seen waning public assistance. The same family of four was eligible for approximately $15,000 less in federal tax credits and stimulus payments. And we saw modest wage increases. As pandemic assistance wound down, wages increased for most low-wage jobs, but not enough to move them above the Alice threshold. I also want to point out, for the purposes of this call and our work going forward, the new Alice legislative district tool. Alice households make up a significant portion of the voting population in every legislative district, yet traditional measures of poverty often fail to capture their struggles. The Alice legislative district tool provides a clear, more accurate picture of the financial hardship at the local level, helping policymakers understand the realities their constituents face. Simply put, Alice families are voters. They work in essential industries, they pay taxes, and contribute to our economy. Their voices matter, and this tool helps to ensure that their challenges are front and center in policy discussions. We encourage you to use this data to engage with elected officials, providing them with the district-specific insights that illustrate how many households are struggling to make ends meet. Policy decisions impact Alice families every day, from access to affordable healthcare and childcare to fair wages and housing policies. Lawmakers need to understand how their choices affect working families in their district. And also, for the purposes called, let's think about actions you can take for Alice. Taking action for Alice means identifying the barriers, whether race, ethnicity, age, sex, gender identity, sexual orientation, zip code, health, ability, veteran status, or immigration status, that limit financial stability, and work towards solutions that remove those obstacles so all people can fully participate in our economy and our society. This series is about moving from education to action, and we're committed not just recognizing how structural inequities impact Alice households, but actively addressing those challenges by doing a few things. One is using data to drive change. We identify where opportunities exist, where hardship is most common, and what specific policy and structural changes are needed to help Alice individuals, households, and communities become more financially secure. We also believe in holding ourselves accountable for prioritizing solutions that center Alice households and calling out actions that fail to support working families. And also building a stronger network of partners by increasing collaboration across sectors and ensuring diverse voices are included in decision-making without overburdening those most affected by these issues. And then once again, coming out of this call, advocating with action. We provide research and data to drive solutions that lift families out of financial hardship, while also challenging the policies and systems that keep people from getting ahead. The ultimate goal is simple: ensuring every Alice household has the opportunity to live, work, and thrive in today's economy. Once again, thank you for being with us today. I look forward to the discussion ahead. And now, Toya, back to you.
Thank you so much, Michael. It's now my pleasure to present to you our first panelist for today's program. Larry Frieman is the Chief Deputy Attorney General at the Louisiana Department of Justice. Prior to his current position, Frieman served one term in the Louisiana House of Representatives from 2020 to 2023, representing District 74, covering parts of St. Tammany, Tangipahoa, and Washington parishes. Please join me in welcoming the Honorable Larry Frieman.
Thank you, Toya, and thank you for having me here at United Way. I'm really pleased to be part of this program. Today, I'm going to talk a little bit about the Attorney General's legislative package and what things we're going to try to accomplish in this upcoming session that is going to affect our community, our state as a whole. And I could tell you, we're going to be very busy. We're going to have about 15 different bills that we're going to be bringing to the legislature. So it is a robust package. One of the main issues that the Attorney General is focusing on, and this is probably one of her signature bills, is to protecting state sovereignty. Now, what does that mean? Basically, she wants to make sure that the Department of Justice and the Attorney General herself is in the forefront when it comes to protecting the state of Louisiana from any of the federal government's overreach and things that they try to impose upon the state of Louisiana that we feel may not be in the best interest of our citizens. So one of the things we're going to try to do is to have the Attorney General be the representative to protect the sovereign interests of the state, to provide the representation of the state agencies, state departments, institutions, state boards, state officials, all in the political subdivisions in matters implicating state interests against the intrusion by the federal government. This bill will also provide for notice to the Attorney General of claims by the federal government against the state and local governmental entities, because sometimes the federal government will come in and sue the state or sue a local governmental entity. We're also going to provide for submission and approval of proposed consent judgments. They'll have to be approved by the Attorney General and the governor before a state agency or a local board, like a school board, can enter into consent judgments with the federal government. All of this is going to be designed to help protect state sovereignty, to make sure that we're not giving up any of our state's rights to the federal government unnecessarily. So that is going to be one of the major bills that the Attorney General is focused on. There's a second bill that's really important to her, and it is involving post-conviction relief for criminal defendants. In this past session, we were able to reform some of that to have the Attorney General's office more involved in these post-conviction relief cases, where a person who's been convicted sometimes later, while they're serving their sentence, come in and try to get their sentence overturned after they've gone through all the steps in the process. And we believe there's a loophole in the law right now that we're trying to close. And basically, it involves where an inmate can file a petition and then let it sit for years, just sit in the system and do nothing and take no action on it for years, sometimes 10 or 15 years before then they take action on it. One of the things that this bill will do will force an inmate to take action within 3 years. And if they don't take action within 3 years, then it becomes abandoned, because we don't want these things to sit out there 10 or 15 years, because a lot of the evidence goes stale, things, witnesses disappear and things like that are important to these cases. So the Attorney General is trying to close this loophole, which will then really put a very more stringent requirements on this post-conviction relief. I think, and that's going to protect our communities, where we're getting some of these folks who are in jail getting let out of jail unnecessarily and back into our community to terrorize our communities. So this will help close some of those loopholes and make our communities a whole lot safer. Another thing that I think is going to be very important for our folks in the state, and we've been seeing a lot of this, is these scams that are going on using Bitcoin kiosks and Bitcoin ATMs, and they prey on our elderly in our society, where they'll call our elderly and say, well, your granddaughter's been arrested and we need you to post bond or send $3,000 through a Bitcoin ATM machine. Well, of course, no governmental agency is ever going to ask a citizen to do that. But we've been seeing this across our state, and it is becoming more prevalent, especially with the advent of the Bitcoin, these ATM machines. So what this bill is going to do, it's going to really try to help decrease these scamming procedures, and we're proposing some regulations on the use of Bitcoin type ATMs, such as a 72-hour hold on the conversion of the deposit. So if someone gets scammed and they realize it, we'll have time to potentially seize back the money. We'll put a limit of about, I think it's a $3,000 limit per transaction. So they can't, that is kind of the same you see in regular ATM machines. And then what we want is a warning placed on the machine itself saying, the government will never ask you to do this. So if you feel you're being scammed, call your local sheriff's office and the number. So some of these measures in this bill will try to protect our citizens, our most vulnerable, which has usually been the elderly folks in our communities. Another thing that we're trying to do, which is going to protect our communities, which we saw in the last hurricane, where some sheriffs were letting out inmates out of jail during an emergency situation without a court order or without permission from anyone. So we have a bill that's going to prevent the release of inmates into our communities during an emergency situation such as a hurricane. They'll have to transfer them to another facility rather than just letting them out into our communities. We also have some Medicare fraud revisions to protect the Medicare, I'm sorry, the Medicaid fraud provisions to protect the Medicaid for the folks who are really in need it and stop some of the waste and abuse that may be going on. And we're also, one of the other things that's big in her agenda is to try to continue to refine and improve the monitoring of juveniles who are out of jail or out of detention in the juvenile system. You know, we've seen some horrific stories of these juveniles who have ankle monitors who are not or have violations of the ankle monitoring system going out and committing murders and horrific crimes. So it's another one of our objectives is to help put more teeth into the law. So any of the violators will then be dealt with more judiciously, expeditiously, and keep those violent criminals, the juveniles, out of our communities. And if they don't comply with those regulations of the monitoring system, they'll be brought back into detention. So those are some of the more bills that I wanted to share with the viewers that the Attorney General is doing. There are others, but those are the ones I think will impact our communities the most, and those are the ones that she's most interested in and moving forward. So thank you for having me on today.
I'm pleased to welcome to today's program Ali Rao, Deputy Secretary for the Louisiana Department of Children and Family Services. Ali, I cannot speak highly enough of the tremendous work that we have done together with the Department of Children and Family Services, and you have been a stellar advocate in supporting and in visiting our prosperity centers and acknowledging the working relationship that we know is so important with the Department of Children and Family Services. I thank you especially for being here and for joining us for today's program, and I now look forward to everyone hearing from you personally. Thanks.
Thanks, Charmaine. And, gotta love technical difficulties. We've all experienced that, and I appreciate your kind words. And I really wanted to open just by saying thank you and sharing my gratitude for a lot of the leaders on this call, for the partnership that you mentioned, but also just for getting into the work with us. So I'm excited to talk through kind of what we're thinking about. I will start off by saying we're in contrast to what Larry was talking about, because DCFS actually has 0 bills in our legislative package this session. Make no mistake, we will be busy. But we do not have any priority legislation that we're bringing forth. So maybe we'll use this time to just talk about some of the things that I know are going to come up, probably touch on some things that you all might find interesting, and then certainly be open to questions. So first, Sunbucks. I know there was a lot of conversation last year around that federal program and Louisiana's implementation of that. We are going to go ahead and roll out Sunbucks again this year. Our goal is to have benefits issued before June, which I think is really exciting. Obviously, a faster timeline, and hopefully we'll get benefits to families at the start of the summer. So more to come on that, but the governor did choose to reoccur that funding. So that's great. The second thing that we're focused on, and I suspect there's going to be a lot of legislative conversations around this, was the work of the governor's task force, specifically around social service and workforce reform. And really 2 components to that. One, there's a really exciting pilot that's come from that work where we are partnering with Louisiana Workforce Commission to deliver as many services to people as possible in a single location. Certainly, that's not a new idea, but it is one that hasn't really been brought to life yet. So that is something that came from the task force that I'm really excited about, because as you guys have been talking about on this call, and certainly it speaks to your work, people need help, and they need as much in one location as they can get. Working your way through 5, 6 offices, having 6 caseworkers, that's a lot to navigate when you're struggling. So we're really excited for that work. We do suspect that from the governor's task force, there will be legislation. We've been having a lot of conversations about the outcomes of that report and some of the recommendations that were made to how can we serve people better. And I know that's a priority for us at DCFS and a lot of the work that I've done with you guys on this call. And then third, as always, we will be focused on our frontline funding and really giving our child welfare workers what they need to help keep children safe. So we've asked for 125 positions, and we're feeling really hopeful about that. Some new vehicles and paralegals to support our legal efforts here at the department. So that's what we'll be thinking about this legislative session. I expect a lot of conversations around the task force and providing social services, really making sure that people are connected and they have what they need to be self-sufficient. And that's what I got.
Well, Allie, I can't thank you enough. And I was remiss in your introduction in not saying that United Way is one of your strongest partners in the work that we have done around 211. I know in times of emergency and crisis, having an infrastructure as that important to be able to house safely our citizens. There are so many things that we care about and that we partner with the Department of Children and Family Services. And I would be remiss in not acknowledging the extraordinary work that we're doing on the SNAP employment and training. Your office has been a leader and just a very strong supporter because we know what that means to our most vulnerable population. So I just want to, again, thank you for sharing your time with us. You honor us by being here today, and we are immensely grateful of the strong working relationship we have with the Department of Children and Family Services. So thank you.
Thank you, Allie. Again, it is now my honor to introduce to you Stacey Roussel. Ms. Roussel serves as Deputy Director at Invest in Louisiana. She brings nearly 20 years of experience in the public, academic, and nonprofit sectors working on issues related to economic and community development with experience in fundraising, strategic planning, program evaluation, and public policy analysis. Stacey is a fierce advocate who has worked tirelessly to advance policies impacting our working Alice families. Please join me in welcoming Stacey to today's program.
Thank you, Pam. It's really such a pleasure to be here. I do have slides to share with the audience, so I'm going to go ahead and share my screen. We'll make sure that that comes up. Okay, can we see that okay? Wonderful.
Yes.
Well, like you said, I serve as the Deputy Executive Director at Invest in Louisiana. I just cannot say enough about the work that United Way has done over the years, really helping us all to understand the Alice population and championing the cause of really addressing poverty and the root causes of poverty in Louisiana. So I'll start there. I'm going to spend a little bit of time today. I'm going to use my time to talk about the state budget. So if you know Invest in Louisiana, you know that budget used to be our middle name. We were the Louisiana Budget Project. And the reason that we focus on that is because we really see the state budget as a moral document. It is how we fund the priorities that we have as a state. And so I do want to just share a few numbers with you as we think about who is impacted by the state budget and just the importance of its role in our state. So about 1.7 million Louisianans receive health insurance through Medicaid. We have almost 700,000 children and our public K-12 schools. We have about 800,000 Louisianans depend on our state-administered SNAP benefits to put food on the table. We also have almost 2 million Louisianans using our roads every day to get to and from work. And we've got about 35,000 Louisianans who are able to continue their education through Go Grants. So as we enter the 2025 legislative session, we're spending a lot of time thinking about some of the budget and the instability that kind of underpins where we are right now. So we're going to spend a little time just talking about that. As you all know, the governor did share his executive budget, which is largely a standstill budget and funds many of the things that have been funded in the past. A few things to know about looking forward. We have talked about the fiscal cliff over the past few years. That cliff is not where we are today, but it has been pushed down the road about 2 years. So we'll share those numbers with you. I also just want to share that we also are seeing some rising expenses on the horizon with education savings accounts and potential increased cost with increased incarceration. The other area that I want to make sure that everyone gets a little more information about is there's a lot of conversation happening at the federal level that could really impact state budgets. And that's through some of these primary programs that we talked about through Medicaid, through SNAP, and through disaster recovery. So as we were talking about with the fiscal cliff, you can see we are relatively stable now, but there is a projection in about 2 years that fiscal cliff will open again as the vehicle sales tax are diverted from the state general fund into the transportation trust fund. And so it's important to be aware that potentially 2 years down the road, we are looking at about a 500 and 600 million shortfall. I also want to just share a little information on the revenue mix for the state and how that's changing based on some of the actions that were taken in 2024. For a long time, Louisiana's revenue picture was kind of a three-legged stool. We had income tax, sales tax, and then all other revenue. Based on some of the changes we have here, you can see that we're going to have a decrease in the personal income tax revenue and an increase in sales tax revenue. One of the areas of concern for us, and I think particularly for Alice, is that our lower income households do pay a higher share when it comes to sales tax. So that's an area that we definitely want to be aware of as a state as we're raising the revenue to pay for the programs that we need. So that's a little on the state side. For the federal side, there's a lot of discussion happening now around some of the programs that we rely on as a state. And so that's specifically Medicaid and SNAP that I want to just raise for folks' awareness. So at the federal level, we are looking at potentially $880 billion in cuts over 10 years that would necessarily, given the number, impact Medicaid programs across the country. We're also looking at a potential $230 billion cut in SNAP, which would also impact all states in the country. Medicaid, as you all know, is a very important health insurance program for our low-income, blind, and disabled Louisianans. Thanks to Medicaid expansion and thanks to the program, we actually do a fantastic job of keeping Louisianans covered by health insurance. This is really a bright spot and a place for us to be incredibly proud of here in the South, and we have one of the lowest uninsured rates among our neighbors. So we want to keep Medicaid strong. We know that it supports work. It also supports being able to caregive for dependents. It's just a great program to make sure people can go to the doctor and remain healthy. Some of the potential budget considerations in this program, right now, if you are eligible for Medicaid, you are able to enroll, and it's a cost share between the state and the federal government. Some of the cost sharing that's being looked at the federal level, if passed, and that includes block grants as well as per capita caps, would transition a lot of the cost to the state or require state houses and legislators to make very difficult choices about cutting services in the future. That's not a position that we want our lawmakers to be in. We want to make sure that we can provide the care that Louisianans need. And then I also just wanted to share a little information about the folks in Louisiana who are on Medicaid. As you can see, the majority are either working, disabled, taking care of family, going to school. And that accounts for, like I said, over 92% of those enrolled in Medicaid. The other thing that I want to drive home for folks as we're going into this session is that Louisiana has a very high reliance on federal dollars. So when we hear about federal cuts to these programs, it's important to understand the trickle-down effect to Louisiana. And with that said, I will cede the floor and also just want to share, it's great to see the Alice Legislative District information. And I'll add to that we also have our district fact sheets available that, that provide information at the legislative district level for all of the programs we just talked about. So Medicaid, SNAP, public school enrollment, and of course, demographics and economics. So cannot thank you all enough for the opportunity to talk a little bit about some of the kind of the fundamentals of how we pay for what we as a state want to provide to our citizens. Thank you.
Thank you, Stacey. We really appreciate that, and that information is very helpful. So next, I would like to welcome Mariah Wineski. Mariah has 20 years of experience working throughout the United States and internationally on social change campaigns, violence prevention, and curriculum development. She is the immediate past chair of the Louisiana Domestic Violence Prevention Commission and previously served on the board of directors for Boulder Sister Cities. She also serves on the Victim Services Advisory Board of the Louisiana Commission on Law Enforcement and the Advisory Board of the Louisiana Violent Death Reporting System. So we'd like to welcome you, Mariah.
Thank you so much. I appreciate the opportunity to be here. Very grateful to talk a little bit about our legislative priorities. Thank you again to the United Way for the opportunity and for their continued partnership on issues related to domestic violence. I also have a few slides that I would like to share, so give me just a second and I'm going to pull those up. Okay, can everyone see those okay?
Yes.
Okay, thank you so much. All right, so just a little bit about LCADV and who we are. We're the federally designated statewide coalition of domestic violence shelters and advocacy organizations all across Louisiana. There is one designated domestic violence coalition in every state in the nation, and we serve a very unique role to enhance and build the capacity of the direct service organizations who serve survivors of domestic violence every day. So most of our work falls into 4 realms. We do legislative advocacy and policy work to support survivors. We provide training for professionals who may come into contact with domestic violence survivors. We build the capacity of the local domestic violence shelters and programs across the state. And we provide public education and social change campaigns to promote long-term changes in societal attitudes and beliefs around domestic violence. So our membership consists of primarily domestic violence shelters and non-residential programs across the state, and together they provide the vast majority of all of the services that are available to domestic violence victims in Louisiana. So everything from 24-hour crisis hotlines, emergency shelters, children's advocacy, support groups, housing assistance, legal advocacy and representation, you name it, the things that a survivor might need to help get safe and recover from abuse. And those are the services that are provided by our membership. So historically, Louisiana has had a very serious domestic violence problem. We have led the nation in the rates of domestic violence homicides, the rates of female homicide victimization by males, which the vast majority of those are domestic in nature. So if you look at this graph, this green line on top is the Louisiana rate, which lingers at about twice the national average, which is represented on the blue line. So this is certainly only one metric of the issue that we're dealing with, but it's consistent with many others that indicate the vast need for these services and safety resources in Louisiana. So in 2021, in response to these consistently high domestic homicide rates, the legislative auditor conducted a performance audit of our state's response to domestic violence, and it confirmed what many of us already knew, and that is that Louisiana did not adequately fund domestic violence victim services, and it recommended that the legislature allocate consistent and adequate funding for domestic violence victim services. So the legislature did act on that gratefully, and in response to a tremendous advocacy campaign, they allocated $7 million in state general funding in 2023 for domestic violence shelters. That funding was allocated again in 2024 after another advocacy campaign to add it to the budget. So it's been 2 years, 2 consecutive years that funding has been included in the state budget. The purpose being to expand and continue domestic violence services in the areas with the highest unmet need across Louisiana. However, of note is that each year that it was added to the budget, it was added as one-time supplemental funding. So the results of this investment have been tremendous. So it led to 5 completely new domestic violence shelters, 6 expansions of bed capacity in existing shelters, which combined have resulted in the addition of 218 new domestic violence shelter beds across Louisiana. In addition, we've established 11 new outreach offices in rural parishes, which is where a survivor can go to receive non-residential services. So that makes safety services that much closer to so many survivors in our state. And in addition to that, we've had vast increases in child advocacy services, counseling for survivors, legal services, as well as intervention programs for those who perpetrate abuse. So there are very few investments that have yielded such clear results, especially when you're working in social services where there are so many variables at play that determine, whether somebody is safe and whether they're, the human behavior and choices that people make, right? However, what we can say with certainty is that these 2 years of funding have finally moved the needle on the issue of domestic violence in Louisiana. So if we look at a comparison, in 2021, our state had only 335 domestic violence shelter beds. We now have over 550. And in 2021, domestic violence shelters were able to provide just over 55,000 shelter nights, so per person per night, to domestic violence victims in our state. Last year, they provided over 80,000. And then such a key metric of success is the number of unmet requests for shelter. So in 2021, victims called needing a domestic violence shelter and couldn't get it almost 2,500 times. Last year, that number was down to 1,461, which is still very bad. There is still work to do, but that is the lowest number that it has ever been. So because this has been positioned as one-time funding, the funds for domestic violence shelters are not currently in the executive budget, and they will need to be added by the legislature. However, we have a lot of support for this issue at both the legislature and at the administrative level. So Governor Landry has expressed support for ending this cycle of coming back every year and begging for whatever extras we might have as a state to sustain such vital and life-saving services. So currently, the shelters receive $8 million in federal funding through their core contracts with the Department of Children and Family Services. And then they receive that $7 million on top through state funding for a total of $15 million. So we look forward to working with the administration, the legislature, and all of our stakeholders to ensure that funding for domestic violence services is adequate, is stable, and is ongoing, because that's what it needs to be. So that will be, of course, our key priority this legislative session. There will certainly be plenty of bills, and many, it's bound to be a busy legislative session, as all sessions are. In addition to our funding efforts, we're going to maintain our core legislative priorities. We promote bills that ensure survivor access to justice in both the civil and criminal settings. And this includes a focus on survivors who have been incarcerated or criminalized or imprisoned for defending themselves against their abusers. We support legislation that prevents domestic violence homicides by promoting early accountability for perpetrators of abuse. We support legislation that promotes the economic stability, a lot of what we've been talking about today, because there really is no safety, long-term safety, without economic security for a victim of domestic violence. And we support legislation that promotes safe environments. So I am one of those people, and we are one of those organizations that actually truly believes that domestic violence is preventable and that it can end. And so we work to create the environments that prevent violence from occurring in the first place. So those are our key priorities. And again, thank you for the opportunity. This is my contact information here. Thank you all for the opportunity to share with you. And I hope you will join us in our legislative efforts this session.
Thank you, Mariah. And don't go far, because we're now opening it up with questions. And we have received a couple in the chat, and they are directed to you initially. Anybody else that has any questions for any of our other panelists, please feel free to put your questions in the chat. So the first question, Mariah, is one of our participants said that they remember hearing a factoid or stat from a year or two ago that homicide is the leading cause of maternal mortality in Louisiana. Is this true?
Yes, unfortunately, that is true. It is, and every year it goes between it's the leading cause to it's the second leading cause. But yes, it is absolutely one of the leading causes of maternal mortality. We have many, many victims who are pregnant and who are murdered. Mm-hmm.
And then, we noticed in the chart that you showed, with the investment that you're able to get more beds, et cetera. However, have the increase in funding for shelter bed services resulted in reduced numbers of homicides?
We believe anecdotally that they have. However, because of the way that homicide data is tracked, in order to have an apples to apples comparison, the FBI homicide data is a couple of years behind. And so we will not be able to see and verify truly whether these have had an effect for about another year.
Thank you. So, Mariah, you were on a hot seat for that that part of it. Are there any other questions out there from any of our participants today? All right, I will go ahead with that, and we will move to the next part. And I would like to introduce Charmaine Cassiope. Charmaine serves as Executive Vice President and COO for the United Way of Southeast Louisiana's Public Policy and Governmental Affairs area. Her 20-year career at United Way of Southeast Louisiana has included the successful advocating for the first ever EITC state match, passage of the child care tax credits, implementing statewide high-quality early child care rating system. She is a fierce champion in the fight against domestic violence, sexual assault, and human trafficking. She has fought tirelessly to secure state funding for Louisiana 211 information referral and crisis management service, early care and education, safe schools, paid family leave, and breast cancer survivor services. So with that, I would like to turn it over to Charmaine. However, Charmaine, I think I might see another question. So let me just see if Yes. Charmaine, do you mind me asking this question before?
Absolutely not. Get those questions in. We want this to be a conversation. We want them to enjoy the expertise of our panelists. Yes.
Excellent. Thank you, Charmaine. So the question is, since Louisiana, and this could be directed to all of the panelists, but since Louisiana receives so much federal funding, what will happen with the decreases in programs presented by the present administration?
I'm happy to kick us off just because I know SNAP has been a part of the conversation. Certainly, I can't speak for Medicaid, and I know that conversation's been a little bit more real lately. In terms of SNAP, we're not currently planning for any significant reductions. And I do think to the extent that you might see reductions, now, like I don't have a crystal ball and I can't guess here. There's a lot of Louisianans that receive food assistance. So any changes there would be substantial. But I do believe, what you might end up seeing is maybe some state share or some pressure for certain metrics or performance. The last time the Trump administration was in office, you saw a growth in the SNAP employment and training programs, which Louisiana took full advantage of. And really, I'm an advocate for that work. So my hope is that we have conversations focused there and focused around how do we help families find self-sufficiency? How do we make sure that we're serving them well towards that goal? But at this point, I don't really anticipate significant changes right now.
Thank you, Allie. Any other panelists?
I can jump in. So I'll try to look and be able to drop in the chat for folks the estimates that they're looking at. The short answer is we don't know yet because the specifics are still being worked out. And so what you have is a resolution on the House side in Congress that outlines a total number of cuts that they would need to have in the budget as it works its way through the process. That current structure includes $880 billion out of the committee that oversees Medicaid along with several other areas. The truth is there's not a way to get to that number of cuts, that level of cuts, without it impacting Medicaid. And so what we don't know is how they would get to that number. And so that's what's hard at this point to provide specifics at the state level. We do know that per capita caps and block grants are things that are being talked about. They have estimates for the level of cuts that would be. And there's also the potential for cost share shifting from the portion that the federal government covers to a higher portion for the state, which would need the need to raise revenue at the state level to keep services where they are. So we don't have at this point specifics as to how they would get to that number of cuts. And then as we do get some more clarity on what that would be, we'll be able to calculate out the impact to the state.
Thank you, Stacey. Any other responses from any of our other panelists? Right. I'm going to go. There's another question. Actually, this is directed to Mr. Frieman. Is there any legislation regarding JRI in the upcoming session?
I'm assuming they're referring to just the Justice Reinvestment Initiative. I could tell you from the Attorney General's package, no, we're not going to be addressing that aspect of it. And in fact, that's really not within our purview. As far as the governor's package, I am not sure. I haven't heard too much yet coming out of the governor's office exactly what they're going to be doing in the criminal justice system, although we are meeting with the governor's people tomorrow morning to discuss some of our bills, and maybe we'll get a better understanding of what they may be bringing. But as I sit here today, I do not have any information concerning what the governor's office is going to do for that type of program.
Thank you. And then there's another question, and I think we answered part of it, Stacey, from where you sit. But for all of our other areas, have there been any discussions on increasing state match on services and programs where there is a federal/state match?
I could speak to the Medicaid fraud unit. We have a state match that draws down significant federal dollars to fund our Medicaid fraud unit. And as we sit here today, we're not aware of them increasing that state match for us. So that we haven't been affected yet by any increases in state matching.
Thank you, Larry. Any other panelists?
No, I'll echo that. We're not anticipating anything like that at this time.
Okay.
And so I'll just
Sorry, go
share
ahead, Stacey.
from the Medicaid reimbursement and services perspective, we have several different match rates for the state depending on the eligibility category. So our Medicaid expansion group is going to have a 90% federal match and a 10% state. Our other areas for children as well as disabled are going to be governed by a different match, which is closer to 2/3 federal, 1/3 state, depending on the specific eligibility category. So, you know, if we get to the point in Congress where they are talking about changing the match rate in order to meet the budget cut goals and guidelines, then we would be able to calculate out what that would be and the burden that it would shift to the state share.
I do see another question, and actually this is for Mr. Frieman. To clarify, what generally causes those significant delays in post-conviction relief requests? And there's several parts to this. I'm gonna take my time as I share them with you so that you know, you have an opportunity to hear and then to share. And then the second part is, why do petitions sit for 10 to 15 years?
Well, the delays, and it's maybe they're kind of the same question, I guess, in a lot of ways, but there's a process that a person who is incarcerated can go through. There's an appeal process in the state, so you appeal it to the appellate court, then to the Supreme Court. Then there's a process in the federal courts, the federal habeas corpus petitions. So that then can proceed through the state, the federal district court, the federal appeals court, and all the way up to the United States Supreme Court. And then once that process is exhausted, then they can file for post-conviction relief. Just so that people understand, post-conviction relief, there is really no legal right to post-conviction relief past that. We as a state allow inmates to do it, but we don't have to. But the reason it sits for 10 or 15 years is that they file these shell petitions very early, and we call them shell petitions, and they sit there with nothing in them, just a placeholder petition. And then sometime later, 10, maybe sometimes 15 years later, they'll come up and say, well, I had some ineffective counsel, or some new evidence was there that wasn't there before. There's a lot of different reasons. But because it's so long after the fact, they become very difficult to defend because a lot of the evidence is missing or gone, or the witnesses are gone or dead, or something happens. So we're trying to make it where they have to act on these things a lot earlier and a lot quicker so that we have the opportunity to properly defend those post-conviction relief petitions.
Thank you, Larry. Any other questions? I'm not seeing any additional questions in the chat, but if there are any other questions, let me see. Oh, yes, one just popped up. So, have there been any discussions regarding reducing the Department of Education budget?
Unknown caller.
I'm sorry. So I'm not sure if anybody feels that they can answer that question.
Ron,
Stacey, okay.
I will just drop in the chat for you. I don't have specifics on that, but the folks at the Economic Policy Institute, I think, just recently released a school district by school district spreadsheet of state, local, and federal funds for every school district in the United States. And so you can look at that for Louisiana to get a sense of the variation really across the state of the role that federal funds play at the district level. And I can tell you from just looking at that this morning, it really ranges from about 10% up to 40%. And a lot of the higher percentage districts, of course, are going to be our districts in poorer communities that really need those funds. I'll see if I can find that as an online resource to drop in the chat.
Thank you, Stacey. Charmaine, I'm not seeing any other questions or comments in the chat, so I would like to turn it over to you.
Well, I would just like to thank you again, Toya, for being the host of our event today, but more importantly, for your extraordinary passion and commitment to the work of United Way, and especially for you taking on the responsibilities to chair our Public Policy Committee. As I hope everyone listening today knows, United Way's Public Policy Committee decides what's going to be our legislative agenda. That then goes to the executive committee, and it's then approved by our full board of trustees. So we want you to know that we are especially grateful for the esteemed panelists who have participated in today's program. Your level of expertise has provided us with a wealth of information that will be considered by our public policy team and our board of trustees. You're ensuring that we have access to the expertise that you possess that allows us to make better informed decisions as we look for identifying what our agenda is going to be. I especially want to say that I'm grateful to everyone who took time out of their schedule to join us. I hope you found today's program to be extremely informative and helpful. I'd like to invite you to continue to stay informed with United Way, visit our website, and engage with the work that we will be doing at the state legislative session during our efforts to try to advocate for policies that we know are so critical to eliminating poverty and lifting up our Alice families. As you can see, I hope, in today's program, my sign behind my head today says United is the way. I want you to know that we cannot advocate successfully without all of us working collaboratively together. We understand the strength of that. And we want you to know that United Way advocates year-round for policies in health, education, financial stability, community strengthening, and we want our Alice households to thrive. Together, we can create equitable communities, and we can engage together to fight for those things and those issues we know are incredibly important to the economic health of this great state. I want to thank you for your presence again, panelists. You have honored United Way by participating today, and we are grateful. I would be remiss in not thanking our President and CEO, Michael Williamson, for his extraordinary leadership. Again, you, Toya. I'd like to thank Todd Baptiste, who serves as our Senior Vice President for Education and Youth Initiatives. I would like to thank Pam Allison, our Director of Public Policy, Marianne Bazil, our Marketing Director, and Mary Ambrose, our Chief Equity and Impact Officer for Community Impact. We are blessed to have a strong, capable team of professionals working at the United Way, and we hope that you value United Way in your community and you value United Way across the state. United is the way, and we need you all. God bless you for being with us today. We appreciate it.
Thank you.
That ends our program.
Thank y'all.
Thanks.
Thank you so much.